Hey folks, how you doing today? My name is Rob, and I'm a 20-year veteran of the Medicare insurance world. I've been an insurance agent for the past almost 20 years, and started out in Medicare and long-term care insurance. By no means that makes me an expert, but it does make me somebody or somewhat of an authority on all of these different Medicare plans. And today we want to talk about the best Medicare supplement plans out there, because that's the most common question that I get all the time. What is the best Medicare supplement plan? They always ask me, Rob, what should I do? And you know what? The best answer I could give is the plan that you have in force that you can afford at the time that you need it. So I know that's kind of a generic and broad answer to this question, but I'll tell you what, if you have something in force and at the time you need it, then it will pay out. But the tough thing is trying to select from all these different plans what the heck you should do. So anyway, you have A, B, C, D, F, G, K, L, M, and N. You'll notice that some letters are missing. Some of these plans duplicated other plans and coverage. So in an effort to try to not confuse people, the government CMS stepped in and said, hey, let's just make all of these plans standardized, and let's get rid of the ones that duplicate other coverage in an effort to least confuse people, which again it's still a challenge because you have all these letters. And I'm just going to give a broad overview, and I'll give you kind of the most popular plans because I have a website that goes over this stuff in detail. And again, I don't want to bore all of you. Again, you should be seeing my website listed. If you just want to jump over to it, you certainly can and check out some sample rates. But with that said, A, B, and C, these plans are available to people over 65 or under 65 that are on Medicare and have a qualifying disability that allows them to be on Medicare. So as you can see, you have A and B, and then you have C. And C is obviously the most comprehensive of all the plans. In other words, it tick marks all of the deductibles and copays. In other words, it takes care of the Part A deductible, which for 2017 and going into 2018 is roughly $1,300, and I'm rounding up. That would be the first day that you step foot in the hospital. You'd have to pay $1,300 unless you have one of these plans to help cover it. And then your Part B deductible, which you have to meet once a year, is $188. And again, I'm just quoting 2017. May go up for 2018. But anyway, just want to let you know what that is. And then you've got the Part B excess charge, which again, none of them cover, but that's where doctors reserve the right to charge you up to 15% over what the Medicare allowable charges are. So it's not a huge amount, and a lot of doctors don't charge it only because they want to keep patients. But I'll tell you what, doctors sometimes do charge it in an attempt to recoup what Medicare doesn't pay them. So there's always a danger, and I always want to point that out to everybody. And then lastly, foreign travel limits, you have up to 80%. And I actually did have a client that traveled abroad, and he actually did utilize this benefit. So again, if you travel, you may want to check this out. And again, if you're over 65, one of the most popular plans is Plan F. And the reason why, it tick marks all of the deductibles and copays or what have you that you could possibly face on Medicare. Again, it takes care of the $1,300 Part A deductible, takes care of the Part B deductible, takes care of the Part B excess, takes care of foreign travel, does all the things that the 20% that you would be faced with it will take care of all of that. And another popular plan is Plan G. And I'll tell you why. It's because it compares very favorable with F. The only difference is that it does not cover the Part B deductible. You still have to pay the $188 once a year before the plan kicks in, and then it will take care of the rest of the 20% for doctor services, outpatient services, MRIs, all that fun stuff. But the big difference is that in certain states, there's a pretty big premium differential between F and G. In fact, there's so much of a differential that G sometimes becomes more attractive than Plan F, because if you, even after you deduct the $188 that you have to pay for the Part B, between the premium and the deductible, it's still less than paying for Plan F. So you have to check with your state and with your agent on which would be better, F or G. And then Plan N is another, that's the new kid on the block. That's another very, very attractive copay, or plan. I'm getting tongue-tied, because of the fact that the premiums are really, really good in most states. They're even better, sometimes $100 a month better than like a Plan G or F. And as you notice, they tick mark all of the important copays and deductibles. However, they don't take part in the Part B deductible. You're going to have to pay that on your own. And they also don't cover the Part B excess charge. So again, that's something that you would have to take care of on your own. And then they also do reserve the right to charge up to $20 copay to visit your doctors. And again, some doctors choose to charge up to $20. It could be $5, $10, or up to $20 to see your primary or specialist or your outpatient. But again, that's up to the doctor whether they want to charge the copay. And again, really, you would have to take a look at the premiums, how often you visit your doctor. In other words, if you're relatively healthy and you only go to the doctor once a year, twice a year, then Plan N might be very attractive over a G or an F. And then I'm not going to get into K and L and M, only because they get really confusing, with the percentages. But they are also attractive, and you can check out my webpage for more information. But I just want to give you an overview of what the most popular Medicare supplement plans are. I mean, if you're under 65 and you can afford it and you're disabled, C is usually the most popular. If you're over 65 and you can afford it, F is definitely the most popular, F or G. And then N would be like the third runner-up, again, depending on your health and how often you're seeing doctors and outpatient services. So again, this is just a broad overview. Hopefully this helped you to kind of see some differences. I will have some sample premiums at my website, so feel free to head over there and you can check out some sample states and what the premiums are. Thanks so much for listening to me ramble on. And as always, if you have any questions, give me a holler, give me a call, and I would be more than happy to help you out. I'm licensed in all 50 states, or the agents I partner with are, so we can get you enrolled one way or the other online. Thanks so much.